So multiple roles is sort of the key of what I wanted to talk about tonight, because I think caregivers have so many roles that they're juggling, so many hats that they're trying to wear. And I think this is just a short list of some of the roles that a caregiver may also be trying to manage: being a parent, being a child, a sibling, a worker, a volunteer, maybe a church member, a neighbor, a friend, whatever your roles are in the community. I feel like the roles are really endless, and that's going to differentiate or differ based on the person. But really, I think these two pictures sort of demonstrate that there can be a whole lot that caregivers are trying to manage in addition to their caregiving role. And so there are a few different theories on social roles and the different social roles that we have and the impact that they can have on an individual's well-being. And there are a couple different theories that I'm going to talk about specifically tonight. One that sort of emphasizes multiple roles is negative, has a negative impact on well-being, and another theory that talks a little bit about how multiple roles can actually have a positive impact on your well-being. So the first theory is RoleStrain Theory. This is a really old theory that comes out of social psychology from the 1960s, and it's been researched ever since then and is still found to be true, that individuals are more likely to find difficulties in meeting demands from multiple competing roles. So this idea is the more roles there are, the more negative of an impact there's going to be, because all of these roles are going to be competing against each other. Multiple roles can result in competition for a limited amount of time and psychological or physical resources. So this theory sort of explains all of these roles are almost at war with each other and trying to fight for the person's time and energy, and that increases stress. So one study, there are many, but one particular study found that stress related to providing care for an ill parent was aggravated by 3 additional roles: being a mother, being a wife, and being an employee. So all of these roles, contributed to stress. All of them came together and created a negative impact in addition to providing care for an ill parent. So role strain, if you think about strain, RoleStrain Theory means too many roles puts a strain on the person. So on the opposite is another pretty old theory that's been around for a while, the role enhancement theory, which is much more of a kind of a positive psychology approach, more of a how does having multiple roles potentially help or have a positive impact. And so this theory shows that greater number of roles means greater number of opportunities and resources to help you build social skills, to help improve your self-esteem. So this idea is like, okay, so I have all these different roles. That's going to help me feel like I'm a competent person. That's going to build my self-esteem. I'm going to have all these opportunities to interact with people, build my social skills, get support. Having all these roles is great. It can really have a positive effect. And so this is seen a lot in women who work and have kids. They report having better physical and psychological well-being than unemployed women who care for children. And I think there's probably a lot of reasons why that could be true. As far as going to work, I think provides a degree of respite, and also in some ways maybe allows a mom to have kind of her own identity or something that contributes to her self-esteem. And I think, women at work, have a good support system. If they have good support, that probably also contributes to positive, better overall psychological well-being. So these are two of the theories out there on multiple roles. One obviously suggesting it's a good thing, one suggesting it's a bad thing. And of course, we have contradictory evidence in the research. Some of the research says, yes, it's definitely role strain. Too many roles is too much, has a negative effect. One example is employed women with younger children reported greater conflict between their roles as an employee and a parent, and consequently greater psychological distress compared to employed women with older children. So instead of comparing employed women with kids to non-employed women with kids, they looked at women and the age of their children. And when employed women had younger children, they really felt like there was a conflict between working and being a mom, and so they felt more stress, and that supports the RoleStrain theory. On the other hand, employed caregivers reported less caregiving strain and better emotional adjustment than those who were not employed. And this is looking at caregivers for those who were caregiving for a sick person in their family, somebody who was ill, and that was their only role. So they reported that while they were giving support and care to their loved one, working was actually something that helped. And so we have support for the role enhancement theory, that an additional role is actually a benefit. So one of the most recent research articles out there right now is this article by Kim from 2006, where she specifically looked at these two theories as it pertains to cancer caregivers. A lot of this research has been done with women, employment, parenting, and nobody's really tried to apply this to what happens when people are caring for somebody with cancer. What about multiple roles in that aspect? And what the researchers ended up finding was, of course, partial support for both theories. So I think they got close to 800 cancer caregivers to fill out surveys. They filled out a whole host of stress measures, what their different roles were, how they were coping, depression measures. There was a measure of how they were developing like meaning and purpose in their life. And so in the end, they found partial support for the RoleStrain theory. So performing two additional roles, so those who were parents and employed and providing care for somebody in their family with cancer, had a greater aggravating impact on the caregiver's cancer caregiving stress and negative affect. So negative affect relates to higher anxiety, more anger, frustration, some of those more negative emotions that we experience. So cancer caregivers who were also working and who were also parents reported more of a negative effect once they started having to care for somebody who had cancer. So there was some support for the RoleStrain theory, but also some support for the role enhancement theory. And that came when cancer caregivers were not parenting, but were only working. So their additional role was just being an employee. They did not have children to take care of. And so those folks reported a beneficial impact of having this other role of being an employee while caring for their loved one with cancer, and reported more positive affect and having more meaning in what they were doing and feeling like they had a purpose. So in the end, both of these theories, again, are supported, partially. It's not all 100% positive and it's not all 100% negative, and it really depends on the circumstances. So what it all means is that multiple roles that caregivers are likely to have in their lives are most likely going to compete with one another in some way, shape, or form. And there may be some strain when caregiving, some increased negative affect, hard time finding meaning, just feeling bogged down by all of these things, all these different roles, multiple roles competing with each other. This is the first study to indicate that cancer caregivers may actually benefit from being employed while caregiving. So we know that those who were working and providing care had better adjustment, more meaning. They saw their employment and their work as respite, as a break, which I could see going to work as being sort of a forced break from caregiving, or sort of forces you to figure out something else for that person that you're caring for while you're working. Although I think there was some qualitative data, some written remarks from some of these folks that participated in the study, and although those who were employed said they felt like work was a good place for support, a good respite, a lot of them also reported worrying about the person that they were caring for while they were at work. So the positives seem to outweigh the negatives, but there were still negatives inherent about, guilt about being away and how's my loved one and what if something happens. So there's definitely some positives and negatives to having these multiple roles. Some of the questions I think to consider are, like, what's the optimal number of roles? Like, what really is the best for a caregiver? And I think having some kind of respite or break from caregiving is absolutely necessary, but you could see somebody who's trying to work like 80 hours a week is probably not going to find that to be very beneficial. So maybe it's more of we should look at how does this work for like part-time workers or people who have a volunteering job on the side. How many social roles can a caregiver carry out simultaneously that would predict the best psychological adjustment, I think, is the key. What is it? Is it one role? Is it two roles? Is it only employment? Is it only parenting? Is it what does that makeup look like? And I'm sure that's going to differ based on the person. One thing that I think was missing from this study is they only asked if patients or if caregivers had children under the age of 18. And I think the child's age could be really, really crucial in understanding the burden of the needs, because somebody, say a mom who's caregiving for her husband with cancer who has twin newborns versus, a mom caring for her husband with cancer who has, a 17-year-old who's getting straight A's and is getting ready to go off to college and is very independent and self-sufficient and emotionally doing fine, are kind of two different stories. I think job stress in general is very important. Job stress can be a huge stressor and role to manage in and of itself, as well as role transitions. So one thing that we really tend to look at in our clinical work as like psychologists and therapists are these role transitions. These are the things that seem to kind of trip people up a little bit in life. They tend to create stress. They tend to create have an impact on your mood. And some of these role transitions are like a job loss or a divorce or an illness or moving or getting married, all these things where there's a pretty big change or transition in your role in life. And so I think it would also be really interesting to look at not necessarily how many roles are caregivers taking on, but do they have any transitions, any things that are happening that might shake things up or create stress? Because I think that could probably have a pretty big impact as well. So some of the other findings from this research were that the majority of caregivers reported that they received support from their employers. So 77% felt like they had good support from work, from their employers, their supervisors, and 85% from coworkers. Although this is hard for me to believe, but no one reported using childcare services, and very few people expressed that they wanted that. So I'm not sure if that's more of a reflection of maybe how old kids were in the study. Like I said, they didn't ask for specifics on ages, but no one was reporting that they were using childcare services or wanted that. So we know support from the workplace is common, and caregivers really benefit from that. So I think the take-home message there is if you're utilizing your coworkers as a source of support, keep doing that because that's a good thing. And caregivers who also care for children may not really consider pursuing any more support, even though they may be having additional emotional distress. So, I think for whatever reason, I don't know if that's because caregivers feel like it's my kids, it's my job, I don't really want to ask for help with that, and so they just aren't seeking support or seeking resources for helping out with kids. But we know that parents seem to really, really be struggling, especially when they're trying to manage being a parent and working and caring for somebody with cancer.